Sweden rejects the notion of shutting their country down and instead focuses on developing herd immunity. I'm Marco Perry. Welcome to the Perry Platform. What's going on over in Sweden has caught my eye. They've adopted a very interesting strategy, contrary to what's become the common knowledge. They don't want to encourage people to social distance too much. They don't want to shut down their entire country. They don't even want to limit gatherings. People are operating as usual. Why is that? Do they want COVID-19? The answer is yes, they do. But that's because they have a strategy. They're deploying the notion of herd immunity. They're going against the grain here. They say, we have a different idea. We don't want to hear these talks about everyone staying home. They want you to go and get it, so you can supposedly develop an immunity. Well, is that correct though? That's what we'll explore today. According to Time, Anders Tegnell, Sweden's chief epidemiologist, has stated the government should allow the virus to spread slowly throughout the population. Anders believes that herd immunity and vaccinations are the only way to escape this pandemic. Now, theoretically, there are some flaws here, pretty glaring ones, and in the world of practicality, there are some other issues too, but we have some data to judge how their approach is doing thus far. Before we get to that, first, let's just explain what exactly herd immunity is. The goal of this idea is essentially to make as much of the population resistant to a disease as possible. Therefore, there are less potential carriers and the disease runs out of host. It just can't spread anymore because nobody is here to get it. The people who are most at risk likely won't be able to develop an immunity due to health complications or some type of issue with getting a vaccine. So this is one way to protect them, to make sure that there are enough shields around them that they don't get it. Now, let's imagine you live in a community of 10 people. If none of you have immunity, the virus can begin with one person, spread to 2, then to 4, and before long, the entire group is ill. There were no shields there to stop the chain. Herd immunity hopes that some percentage of that community will develop a resistance and can come in and act as a barrier. Maybe one person starts off by getting COVID. They would need to pass it on for it to spread. But if the people they pass COVID-19 onto are immune, the virus ends right there because it dies. It can't move on. From the first patient, it goes on to 2 more. But those 2 people have already developed an antibody or something like that. They can't get sick. The virus goes kaput and it can't be shared further. The chain breaks right there at the initial stage. The hope is that enough people can break the chain that it doesn't reach an astronomical height, and the most vulnerable people who aren't immune become shielded through that. Now, this only works if a large percentage of the population is immune though. Otherwise, there won't be enough shield, so to speak. I'm talking like 85 to 90% of the population has to develop an immunity for the strategy to be effective. Otherwise, the virus will just slip through the cracks there. And that's one reason why Sweden is encouraging a lot of people to get the disease. It won't work if only 20% of the population has COVID-19. They need 80 to 90% of people to get it and hopefully develop an immunity. That's pretty intense. It's kamikaze-esque. Now, take this example of 10 people and expand it throughout an entire country. There you go. You have Sweden. They want to let people frolic about and encourage them to actively get COVID. The hope is they'll become immune and there'll be a shield now to protect other people. And from there, you can return to life as usual. In fact, reports cite that Sweden is operating as normal already. The streets are as busy as they were prior to the pandemic, according to some witnesses. A sense of panic is not in the air over there. People are just operating as they would otherwise. So, now, let's examine this idea theoretically. Herd immunity works in numerous other viral cases, that's true. There's good patterns here that we can learn from. But there is a stark difference with COVID-19 though. We are unsure if you can actually develop immunity in the first place. That's what this herd immunity thing is based on. If the virus though is something that we don't develop an immunity to, the entire framework shatters, and right now we don't have evidence to point to people who have become immune indefinitely. There are some people who get it and get it again, according to some reports. If that's true, if you can contract COVID again, even after you've had it one time, well, there goes your herd immunity. it's basically useless, and you've encouraged your population to get it one time for no reason, basically. If they are still susceptible, then that sucks. You need a vaccine, but the vaccines aren't ready yet. There's also another possibility here. Maybe you develop an immunity, but how long will it last for? This could be something like the flu. Now, of course, people who compared COVID to the flu, broadly speaking before, got raked over the coals for it, but in this regard, it's a valid comparison. The flu mutates every year. There's a new flu vaccine every year because your immunity has become outdated. What if COVID-19 behaves like that? What if you become immune for a short period of time? Maybe a couple months, maybe 6 months, maybe a year. But after that, you are susceptible again. This entirely collapses your entire herd immunity defense because your shields are trained to block one thing, but the virus has morphed into an entirely different weapon. A weapon your shields can't combat. You will need new shields then, and if that's the case, your prior herd immunity was wasted. The virus is completely different now. You need a flexible approach there. The fact that I want to highlight is that we don't know if immunity is something we can bank on. We don't know if it occurs even, and to what degree. We don't know if we can rely on it, and we certainly don't know if we can place the entire health of a country on this one hope. Because really it's a hope right now. The scientific data isn't here yet. Now, they also mentioned that vaccines are part of their plan, but that seems premature to me. We are unsure when they will be available. We kind of know that they will be. Scientists are working on it right now, but typically, people are citing we are at least 1 year away from that. With something like polio or measles, we already have a vaccine, so herd immunity makes sense. We have something here that will help us achieve our aim. With COVID-19, it doesn't exist. We're simply banking on immunity, something that we are unsure of. And the vaccines are also cloudy too. The entire approach here is embedded in uncertainty. Of course, there's uncertainty with a lot of things in this COVID environment, but right here seems to be a extremely blatant example of it to me, and an example that comes with dramatic risk. In this attempt to produce herd immunity, people are gonna die, and it won't just be the old and the frail who succumb to it. When your entire populace is rushing out there, attempting to get this disease, you don't know what that's gonna do to people. People are trying to flee from it in other countries, and people are still dying across a wide variety of dimensions. Now in a country over here, we have people who seek it, people who want to get infected, people who are willingly taking it into their body. Will that increase death rates? Maybe. We don't know for sure, but it's possible. Is that a risk they want to take? It seems like they do, because this is the plan they have gone with. This also poses another interesting problem. This price of developing herd immunity. How do you calculate that, and is it worth it? It's certainly not free. You have to get the virus first, then you have to survive. Some people will not survive. If a government encourages their citizens to get the disease, are they responsible for the collateral debts that come from that? If I were to devise a plan for people to avoid getting COVID, but people still ended up getting it, that's one thing. If I were to say, take these precautions, try to avoid it at all costs, I don't want you to get sick, and people get sick and they die, well, that wasn't my intended outcome. I tried to mitigate that, and I tried to stop it. My responsibility is curbed to some degree, if I had good intentions there. But if I intend for that to happen, if I make a plan to bring about getting everyone infected, if I tell people get infected, you're going to develop an immunity, and you don't, if you end up dying, I played a role in bringing about that reality. That's going to weigh on the government's conscience if they have one. If the plan works, the government may be celebrated. If it backfires and immunity isn't as reliable as they believed it to be, they'll have played themselves. It's a pretty high-risk bet to make without data to confirm the approach, to confirm the validity of this tactic over here. I will say, if the Canadian government tried to adopt this strategy, I would be vehemently opposed to it. I would think it's too risky and the evidence doesn't back it up. But Swedish people seem to be okay with it, as I'm going to cite in a later segment. Half the population supports what's going on. Now, we do have some data that points towards the current outcomes that are occurring. That may illustrate how successful the strategy has been thus far. So, according to Worldometer, Sweden has about 11,500 cases, and from that, they have about 1,050 deaths. That puts the case fatality rate at about 9%. That is ridiculously high. Denmark and America's case fatality rates are about 3%, to put it into context. These guys are tripling that. I have to point out too as well though, that these case fatality rates are inherently flawed. The equation is deaths divided by cases. That's how you get the case fatality rate. Typically, the larger the denominator, the more diluted the percentage becomes. So 1 over 10 is 10%, 1 over 100 is 1%. The bigger the denominator, the lower your percentages. We can be relatively assured of the deaths in this case. Those are pretty obvious and they're recorded. When somebody dies, it's hard to overlook that. There is debate about attributing COVID to cases where it didn't cause the death per se, but aside from that, the numerator is overall sound. It's the number on top, the number of deaths. But the case number though, the denominator, that is up in the air. We can only report cases that we've tested for. If you do not test the entire population, the numbers will inevitably be off to some degree. This is because some people only have minor symptoms and they don't ever get checked. That means they had COVID, that was a case of it, but it was never recorded. Some people also are asymptomatic and they don't even know they're infected. That's a case as well that wasn't reported. Some people have it, but they just don't get tested because the government isn't acting responsibly. So the official count just isn't entirely representative of the situation. It's more of a sample. Sweden has been accused of having low testing protocols as well, so that makes sense here. It could be that many more Swedes had COVID-19, but it wasn't reflected in the case figure. If we assume that's true, which I believe is likely, that denominator would be larger. It would dilute the percentage and it would be lower than 9%. But to what degree though? We don't know that. In practicality, no country knows their own case fatality rate either. It's hard to arrive at the absolute figure there, so there will be some degree of wiggle room. Data is king during this pandemic, but it's hard to collect holistic information. A lot of these figures are estimates or conjecture based on incomplete intel. But aside from that, regardless, these numbers are still troubling. To have a supposed death rate pushing 10% is bad in any context there. It either means your testing is terrible or somehow the disease is far more deadly in this country. The data is telling you, based on whatever incomplete information it has, that 1 in 10 people who get COVID in Sweden are going to die. That's not acceptable. They need to test more vigilantly to figure that out. These numbers are just astounding. So, in terms of raw testing and current death rate, Sweden is clearly failing. They aren't testing enough, I feel, and the death rate is astronomical, far higher than other countries, and that's just absurd. And then to take that and say, hey, go get COVID, it doesn't add up. If your figures are saying your death rate is 9%, you can't in good conscience tell your country to go out there and get it. If you want to do that, you have to have the right data. If you can find a way to count up accurately how many cases there are, and if that brings the percentage down and it's a reasonable level, then maybe you have a leg to stand on, but currently it just isn't there. You can't really excuse this aspect of it. How much of this death rate is due to the herd immunity strategy, we don't know exactly. There's so many variables here, but here's something also that's interesting. If we change our ratio from fatality rate to deaths per million people, Sweden is doing relatively well there. Per 1 million people in Sweden, 102 have died from COVID. That is better than in Switzerland, the Netherlands, the UK, France, Italy, Belgium, and Spain. In Spain, which is on the high end, the deaths per million are 386. In America, it's 72, and in Canada, it's 21. So pat on our back, we're doing well in this regard. But Sweden, relative to Europe, is doing well as well based on this metric. North America is obviously far better, but why is this? I presume it's again related to the denominator. This time, we're replacing the case rate with a static million people. That's not flexible. It's a certain degree that will be there. There is no guessing. The death rate is also relatively certain. As we pointed out, it's hard to overlook that. So this produces a more concrete measure that isn't reliant on completely inaccurate testing. Sweden's testing has been garbage supposedly, so it makes sense that in this ratio they perform better, where you remove that variable. Overall, we still don't truly understand the big picture, but per million people, the deaths are lower than many European countries who have locked down. Conversely, in North America, where we have also locked down, the death rates are lower here. So it's clear there are other variables at play. To base your entire conclusion off of that would be wrong. We can't tell with absolute certainty how much of this is due to their herd immunity strategy. There are so many things at play that compound the equation, but this is a hint here. Only time will tell who is correct. Critics are expressing heavy disapproval of Sweden's plans though. They label it dangerous, which I think is fair. Thousands of doctors signed a petition trying to get Sweden to change their mind, to reconsider their approach of infecting everyone. They correctly state that there is no scientific evidence to back up this strategy in the COVID context. As mentioned before, we don't even know if you can become immune and for how long, to what degree. If you get reinfected, the entire idea of herd immunity goes out the window because you're not immune to it anymore. You're not a shield. A head doctor at a major hospital in Sweden says this will probably be a historical massacre. That's pretty scary. Maybe he's overhyping it, but we don't know. One thing I forgot to mention too, which I am reminded of here, is healthcare. One of the reasons for staying home is to flatten the curve. If everyone goes out into the streets, happily getting infected, the hospitals will need to deal with that. If the hospitals get an influx and visitors spike to levels they can't handle, the entire health network would crumble. This is a very real problem that could stem from this relaxed government approach. You can think of it like this. If you have a bill of $1,000, but your bank account only has a $500 amount in it, you would be screwed trying to pay that all at once. But if you are allowed to break that payment up into $100 segments over the span of 10 months, you can pay it down and hopefully recoup your money in your account throughout that time period. Maybe you have a job where you replenish your money every month, so you have more money to pay for it and you won't be overwhelmed at one time. But if you are forced to get hit by that $1,000 fee right now when you can't afford it, you will go bankrupt. It's the same thing with the hospitals. We don't want to bankrupt them. We want them to perform as they should. And the only way that we can do that is if they're not overrun by patients with COVID-19 trying to seek help. After in Sweden, they have supposedly tried to actively get it. If they aren't careful, that entire system could shatter. This doctor, who remains anonymous, mentions as well that workers who tested positive but aren't showing signs are encouraged to continue working. This appears to be rather excessive in my opinion on the government's part. It's almost like they've become infatuated with the virus. They love it. They want it at all costs, almost like a cult of sorts. If this report is true, telling staff to work while infected, that's unethical. They've basically gone all in on this tactic, and if their cards aren't favorable, they'll be in a bad place. Despite that, citizens are split. 48% say they have very high or high confidence in public health authorities. It's fairly split. Half of them think it's really good, the other half are undecided or against it. The uncertainty and lack of data is likely driving this divide here. The bottom line really is this though. We need more data to inform our decisions. Sweden is YOLOing a little bit here. What's that stand for again? You only live once. Yeah, I almost forgot for a second. That's kind of how they're looking at it. We need to act now. We need to all get the virus, go gung-ho, and maybe we can develop an immunity. Well, it's uncertain. We don't know if that's true, but time will tell. I will say this though. If I was the one in charge, if I was leading a country, I wouldn't be comfortable telling my citizens to openly seek out this virus, especially when the current data, because of my lackluster testing, is pointing towards a 9% fatality rate. And on top of that, I wouldn't want the world to imitate my evidence because I could just destroy thousands, if not hundreds of thousands of lives from it by encouraging people to seek the disease in hopes of immunity when there is no data to prove that. What are they going on? It's likely a whim, a hope, or a wish. I could be wrong here and I hope it works out for Sweden, but it just seems far too risky an approach to me. There seems to be more moderate ways that we can go about trying to return to normality. The reality is this. Right now, in much of the world, people are locked down and they are being forced to self-isolate. This is a temporary measure. We cannot operate like this indefinitely. The time will come where we do have to return to life as it once was. Otherwise, the economy and the government will just fail. They can't provide for us indefinitely. The resources are just not there. So how do we approach that? Maybe in the future, once we flatten the curve a little bit, there will be an opportunity for those who are less vulnerable to return to work. Maybe something like that can work, but once again, we don't know when. That's because the data is not complete. What we need here is information. All of our decisions have to be based on that. We can't be making arbitrary promises of opening on a certain date when the data doesn't back it up. So what do we need? We need more data. We need better projections. We just have to be more informed here so we can make the best possible decision. We can't be going off of conjecture. That's my main problem with this. Experts are not telling you what we lack. Government is not acting to bridge that gap. We have to find out what we don't know. And from there, we have to make a plan to act accordingly. Right now, we're taking shots in the dark, and that doesn't seem appropriate to me. Let's get some more testing out here. We need to ramp up research, and we can't be trying to shut down disapproval of what the norm is. We need some debates to occur so we can find some valid solutions. Now, back to Sweden for a second. I just fear that the risk there may have been far too high with too little data to back it up, and they might realize that when it's too late. That would be highly unfortunate, but once again, I could be wrong. Maybe they found the secret to combating the pandemic in the best way possible. Only time will tell, and we'll have to wait to see. But in the meantime, I implore governments and health organizations to just focus on the data. We need that, and we need it now. So, that now brings me to the end of our conversation for today. You can find me online at perryplatform.org. Also, if you enjoyed the content, be sure to leave a review and share. That'll help us grow. Thanks for joining me, and I'll see you soon.